Well, good morning. My name is Greg Brown. I am one of two co-chairs of HIP-Cuyahoga. I also lead Policy Bridge, which is a research and advocacy public policy think and action tank, and we focus on issues affecting African American and other underserved communities. I would like to welcome you here today. I'd also like to let my co-chair and colleague, Heidi Gullett, say a few words too.
Thanks, Greg. Thank you all so much for coming, and thank you for braving our first winter weather advisory. I was like, of all days, no. But we really appreciate everybody coming and coming early. So we hope this is a great day. We've tried to make it as interactive as possible. The first part is going to be us talking to you to give context, but then we have a great speaker who you'll learn more about shortly, and we hope that this is a chance for us to create more of our future together. So thank you for being here, and thank you for your precious time. We know it's a lot to give up a full day out of the office, but we're really grateful for you being here.
So thank you, Heidi. One thing we do want to acknowledge, first of all, is that we understand that there are a lot of new faces in the room. So first of all, could those of you who are here for the first time, could you just raise your hand so we could see? Outstanding, outstanding. Well, welcome. We hope that you find this day not only informative, but you are here because your interest has been piqued around trying to figure out how to work with this consortium to advance the work that we're trying to do in Cuyahoga County. I'd also like to take the time to identify and recognize the people who serve on the steering committee who work with Heidi and I and the Backbone organization at the Board of Health to make sure that the vision that we're trying to reach is implemented in a very strategic way, but also in a way that encompasses the core mission, vision, and our value of trying to make sure that everyone has an opportunity to live a healthier life in Cuyahoga County. So could the steering committee members please stand up and be recognized? Let's give them a hand, guys. These people do a lot of work. They do it pro bono, and we spend a lot of hours together. And if you could look at the slide behind me, what you see is the different sectors that are represented. We are a very diverse group of people from multi-sectors. We work across sectors, and we're all trying to focus on improving the quality of life for people here in Cuyahoga County. So without further ado, we'd like to do a little context setting for you. And what that means is, for those of you who are not familiar with our work, we start out with, what are we trying to accomplish today? And there are three things that we want to do. First of all, we want to increase understanding of the opportunity and strategies for transforming health through large-scale institutional and systems change. And that's a big one. We might be working on that for the rest of our lives, but it's very important because if we don't work at that level as well as at the programmatic or intervention level, we'll never see our successes sustained over time. The second thing we want to do today is to increase the understanding of achieving transformational change within HIP-Cuyahoga. And once again, that's very important. You're going to hear us talk about where we've been and where we're going. Over the last few years, we spent an inordinate amount of time working on our key priorities, and that was very important because that's the way we kind of led with the work going forward. But what we have come to understand is that all of that work within systems that don't adapt to those changes really means that the work is not able to flourish and fully reach its potential. So we've got to start to think, what are the systems and structures that we incur not only within HIP-Cuyahoga, but outside HIP-Cuyahoga, and how do we then change those systems to adapt to our frame of thinking and the implementation of the work we're trying to do. And then last but not least, we want to describe HIP-Cuyahoga's partners' efforts to transform environments, systems, and policies to improve health. You're going to hear later on today some of our partners, the work that they're doing. This is fabulous work. It's time intensive, it's labor intensive, and it's also working contrary to some of the ways we've been taught to work in the past. That's what's exciting. But the innovation really is that everybody's trying to do this in a collective way and to promote equity as a framework for change. So if we could think about those things as we move forward, those will hold us throughout the day. So how did this begin? This thing that's called HIP-Cuyahoga. Several years ago, 2009, there were people in this community, one of which was Sandra Bird Chappelle, who started to bring people together. And those people were called the Cuyahoga Place Matters team. The Cuyahoga Place Matters team is now called the Center for Achieving Equity. But that team started to look at not just the issue of health and how health disparities impact communities, but it also started to think about how does health equity, racial equity and inclusion, and the intersection of social determinants of health play a role in the conditions that we see every day that people confront. So there are people like Sabrina, who's in the room, Martha Halco, Michelle Binko, others, including myself, who started out on the Place Matters team under the tutelage of Sandy Chappelle, trying to understand how we change the way we look at people in neighborhoods, but also change the systems that impact their quality of life. We then were fortunate to work with Jason Reese, who at that time was at the Kirwan Institute at Ohio State University, and he developed a report, and that report really looked at the confluence of race, policies, and real estate in Cuyahoga County and its influence over the conditions that we have seen and how race, policy, and real estate have contributed to the conditions not only that we see, but are prevalent today. And he was able to go back and look at documents from Congress, and he looked at laws, and he looked at customs, and was able to put together a really striking report that basically said that the systems we designed worked the way they were supposed to. And they led to not only racial and financial discrimination, but they continue to perpetuate themselves even as we speak today. So without those considerations as overarching things, we were not able to, or we would not be able to make the substantive changes we need to make in the improvement of quality lives for people. And putting those two things together means that you have to work not just from the bottom up, but from the top down, and meet somewhere in the middle, trying to assure that the changes that you're trying to do have symmetry, but also really do create change that's impactful for individuals. As a result of all of this, there was a recognition of the impact of structural racism on health in Cuyahoga County. And as a result, the three health departments, Shaker Health Department, Cleveland Division of Public Health, and the Board of Health came together and started to talk about how to do even community assessments differently. Part of it was motivated by the fact that the state was starting to say that we wanted people to work more collaboratively to develop their plans and their CHIPs. But the other piece was that there was a recognition that all of the interventions we were doing and all the things we were trying to do were great strategies, but they were not really moving the needle as it related to indicators of quality health for people living in certain neighborhoods. And those neighborhoods are not just in the urban areas. You know, once again, we look at the urban area, we look at suburban area where poverty is rising faster than any other area in the country, and also in rural areas. So we started to understand that what we were doing was not moving the needle. It also wasn't improving people's lives. So the community health assessment and the community health improvement plan that came from that was really an attempt to try to start to change our perspectives about how we work in what work we do. As a result of that, this work that started in 2009 and has been in place almost 10 years now, became more formalized. And we created a consortium with a mission and vision, and our CHIP was released in, I think, 2015. And what it does is it focuses on defining equity and building capacity to frame our collective work through an equity lens. And we'll talk more about that as we get into our presentation, but I think it's very important to understand that the innovations we're working here, and I'll stress that again, the innovations are our perspective transformation to use an equity lens, and also our work together for collective impact. So as you can see, where we started from 2010 to 2015, we had a few but strong. We were small but mighty. And from 2016 to 2017, we've had growth. And Heidi and I were just discussing this morning, we have over 1,000 members now. That does deserve some applause. I think the fundamental thing to say here is that people are catching on to the fact that we need to do business differently. And they think that this is a viable alternative to doing business differently. And so one thing we want to say here is that we are very thankful for all of you here in the room today. We're very thankful for all the work of our partners, all of the time, energy, effort, and resources that you provide to help us do this work. Because what we know is that's the engine that provides us with an opportunity to be catalyzed for action. So what do you see in front of you? You see a map with a large circle that is red. Does anybody know what that is? I'm sorry?
Redlining areas?
It is an area that was redlined. It's also an area where most of the issues that we see today started from. So if you look at the issue of life expectancy, or where the population of African Americans are, or where the poverty rate is, that circle encompasses all three of those data points. There's something I learned a few years ago as I was exploring some of this work around systems change that really started to change my frame around this. And I will just say this, and it's something for all of you to hold today. As we think about what we do, remember, every system is exquisitely designed to produce the result it gets. So if we want something different, we have to make sure we design it to be different, and we ensure that we make it different. It won't happen by our good intentions alone. So what are the solutions? There is no silver bullet solution to addressing the complex factors that shape opportunities for people in our community to be healthy. It's not a one shot, all you got to do is answer. No single organization can create such a large-scale lasting change. Can't do it by ourselves. And to have the greatest impact on health and well-being of our community, we need to coordinate our work and our resources around well-defined priorities and goals. That sounds so easy to do, but as many of us have found out over the last 8-9 years, it is not easy to do. In fact, it's difficult to do because everything else is set up not to operate that way.
So this is a picture of our CHIP. Many of you, CHIP meaning the Community Health Improvement Plan that Greg referenced, we released in 2015. So many of you were part of this, many of you authored components of this plan. But what we wanted to do today was really give you that big picture where we've been, but giving a setup for where we're going. And so this community health improvement plan was our roadmap for 5 years. 5 years have expired. Okay, this was 2013 when we did our first assessment, and so it goes by when the assessment was done, not when the improvement plan was published. So we are now at a really exciting time because we can talk about having built equity capacity and having used an equity lens for this initial assessment and community health improvement plan. We're in a very different place 5 years later. And so this afternoon you're going to hear from several folks who've been working on this for the last 4 to 5 years and talk a lot about where we are now and where in 2019 we have some exciting opportunities to get more community input and determine what the next priorities will be for us. But it all started back here with the 2013 assessment and the 2015 plan. So we were really proud of this plan. We still have copies of it that we keep in our offices. But this is not a static plan, and it's not a plan that just collects dust. This is an organic document that grows as we grow as a consortium. And we hope today that you'll help us create what those next steps look like together. So this is our framework for action. Many of you have seen this. It's been through many iterations over the years, and it will continue to be. Future iterations will look different, but this has been our guide really for the last 5 years or so. And so I want to just walk you through, and then Greg and I both are going to peel out our first 2 key approaches a little bit more to give you some more input about where we are with those particular areas. So our vision is that Cuyahoga County is a place where all residents live, work, learn, play in a safe, healthy, sustainable, and prosperous community. That, you guys know that, you've seen that. Maybe that's what drew you in, is sort of that vision, right? We're not there, but it's a place where we hope equity will be achieved. We believe it will be achieved in our lifetime. Our mission is to inspire, influence, and advance policy, environmental, and lifestyle changes that foster health and well-being in this community, being our county. That is not easy, and so we tend to sort of retreat into our default positions of doing what we know and what we're trained to do. That may be working downstream. For me, that's working in a clinical office and treating high blood pressure and diabetes, rather than thinking about what are the systems and the policies that created that high burden of chronic disease for a particular neighborhood. So I go to where I'm comfortable, right? And I retreat to what I know how to do. When in reality, when working together, we've been able to really think differently and bring our different lenses and say, let's stop talking about downstream. We still need to keep doing that work. People really need that work to be done, but we need to think differently about what we do. And so our goal here is that this consortium, as we move forward, really is continuing to push the envelope about how we think more upstream. And then our core value is building opportunity for everyone to be healthy and to reach their full health potential, and really, to be honest, their full potential. And that's what equity is about. So you're going to hear a little bit more about how we've tried as a consortium to weave equity and an equity lens through all that we're doing. But you can't really think about influencing policy until you get to a place where you have enough capacity to understand equity in the community. So we finally feel like we're moving in that direction. Early on, we hired a lot of consultants, and I think they thought like we knew what to say, but we didn't actually know what we were doing at all. And we still don't, right? We're all learning together. That's part of what makes this work exciting, but also scary and challenging at times. But there were times where they were like, push this policy agenda, you guys can do this. And we're like, hold on a second. We haven't really adopted an understanding of systems and structural change yet in this community and among our consortium. So we really focused a lot inward, and at the end we'll talk about how we're moving more from the inward and organizational capacity building within the consortium to actually extending out to new partners and new sectors beyond who have been involved so far. So we originally had 3 key approaches. Those were collective impact, community engagement, and health and equity in all policy. So those are the 3 that you see sort of on the bottom part of the circle. And Greg's going to talk a little bit more about the transition of including perspective transformation. But perspective transformation has been now for a few years our primary key approach. And that, I think, was a real pivotal change that we made in the work that we're doing and the strategic vision that the group created together. The next key approach is collective impact, and in a few minutes I'm going to unpack that a little more. Many of you know that we're learning collective impact as we go. There is no one way to do collective impact. There are some key elements of collective impact, but they have to be operationalized in local context. And so we're going to talk a little bit about how we've done that. Many of you joined us for a webinar about 18 months ago where we unpacked where we had gone with operationalizing each of those parts of collective impact to date in the consortium, but we've moved beyond even that over the last couple couple years. The third is community engagement. That is really critical to all the work we're doing, and we have a work group on community engagement chaired by a number of people in the room here. And then our fourth is health and equity in all policy, and that's the one we've really done the least amount of work on because you've got to do a whole lot of other work before you can get to systems and policy change. And that's where we feel like we're really poised to go next as a consortium, and we want to hear from you about what you think we should do there or how that can happen. And then in the center, we have these outcomes that we really hope to achieve. Ultimately, achieving equity in this community is what this is about. But we also have the goals of improving well-being and improving population health. This started because it was a health improvement plan from our 3 local health departments at the time. And it continues to be that, but it's so much more than that. So we hope we see population health improvement, but this kind of work takes a while to see that. So we really want to also be thinking about what are we doing in the systems and structure area on the way to getting improved population health. And this afternoon, we're going to talk a little bit, we're going to show you an example from another state where a lot of this work has actually done that and where we've seen population health improvement. So we kind of want to show you where we're heading and where we think we can make a lot of change. So many of you were also involved, but not everyone. We know at least a third of the room based on registration is new. So we also wanted to talk to you a little bit about how we came to our key priorities. So in 2013, there was an assessment which included qualitative and quantitative data. It was a formalized process that was guidance from some national public health agencies about how to do community health assessment and improvement planning. And we had some facilitated sessions and a number of really phenomenal consultants who are equity grounded who came and helped us understand what priority areas really matter to our community based on the data that we got. So those qualitative data sources, quantitative data sources, what really mattered. And the 4 key priority areas were not to the exclusion of the other 9 or so that rose to the top as sort of separating themselves as important. But these were chosen for various reasons, because we thought we could do something about them, because we thought that they were high risk, high reward. For example, eliminating structural racism. Nobody thought we could eliminate structural racism in 5 years, but we knew that if we didn't tackle it, our chances of actually making an impact on improving long-term inequities in this community is probably not going to happen. So there were different reasons that different ones were chosen. So eliminating structural racism was chosen. Healthy eating and active living, which has morphed into a beautiful collection of multiple sectors working together around a lot of healthy eating, active living initiatives. You're going to hear about a few this afternoon, but there are so many. Linking clinical and public health, and a lot of that work was focused on bringing the assessments together. So bringing health systems, healthcare systems, and public health systems together to think about what actually matters for our community, not just what matters for your own organization or your accreditation in the case of public health, or the need to have an IRS exemption continue in the case of our hospitals, not-for-profit hospitals, but what actually matters for the community. And so that was something that we've been working on, and amazingly, we are actually releasing our first collaborative assessment today. That wasn't an accident. We timed it with the consortium meeting. We just got so excited. But you're going to hear about it this afternoon, and that is the next incremental step to doing a wholesale collaborative assessment in 2019, which we hope you will all be part of and your organizations will be part of. And then the 4th key priority was chronic disease management, which has primarily been focused on high blood pressure over the course of the last 3 to 5 years since we got the assessment in the Community Health Improvement Plan, and then also some REACH funding. And we'll talk a little bit more about our new phase of REACH later, but that REACH funding that we've had so far had done a lot of support for the chronic disease management and healthy eating, active living priority areas.
So as Heidi has said, the overarching key approach that we have kind of morphed into is this idea of perspective transformation. And it really emerged because of our work in the Eliminating Structural Racism Subcommittee and the understanding of people in that subcommittee and throughout the consortium that this idea of eliminating structural racism was really something that we had to tackle because of the impact not only on people in our communities, but the communities themselves. What we've learned is that nobody, whether you're a person of color or not, gets away from the issues and the problems that emerge and continue to emerge as it relates to racism in our country. We are all affected by it. We are all infected with it. So the only way to really approach it is to have honest and frank conversations about what we do, why it exists, what is the value proposition that we are trying to underscore and really promote. And then last but not least, what's the solution? And the solutions will be as varied as people's perceptions about it. They will be as difficult and complex as the issue of us being honest with ourselves about what we do. But the other piece is that if we're really in a democratic society and we do believe that all people are created equal, then we have to do something to make sure that the least of us are treated better than they've been treated in the past. So, thank you. So the idea of really working with people, not just to think and understand differently, but then to be able to act differently is something very important. We determined this to be foundational in our collective work for the long term. We can't escape this. You know, we keep looking at the data and we keep thinking that we're going to strategically think our way out of how to deal with the inequities and the issues that confront us, not only in healthcare, but in employment and transportation and housing. We could just go down the line. The issue is, what are we really going to do about it, and how long can we allow this to persist before it starts to have not only social impact, but economic impact on all of us? So we transitioned this idea from a priority area to our first key approach, because we understand without putting this front and center, it will be pushed to the side like many other times people have talked about the issue of racism or the issue of sexism. And it gets marginalized because we go about the business of doing the work first and not thinking about that work in the context of those issues. We want to focus on building the capacity to think, understand, and act differently to make equity and racial inclusion a shared value. If we don't make it a shared value, then it won't become one. And it's people like us who can lead the vanguard of that. It's us actually starting to say is, would we want to be treated like some others in our country are treated? And we're not talking about people who come from other countries. We're talking about people who were born, bred, raised, and acculturated in our American society. And if we're comfortable with that, then we have to start to understand where that comfortability comes from and what do we need to do about it. We believe that this idea of perspective transformation is a continuous process of both individual and organizational transformation, and it's grounded in shared understanding. And what do we mean by shared understanding? If we don't talk about the issue openly, if we don't challenge the assumptions that some of the things that we do are based on, if we aren't willing to stand up and say there's got to be a better way, then we're doomed to repeat the same thing over and over again. And Einstein said, that's insanity. So when we talk about perspective transformation and we frame it in the context of really thinking about how to change people's heads and hearts, we really mean that. And I know for many of us who are clinicians or who come at it from a clinical perspective, you can't start without understanding who's receiving the work that you're doing, who's receiving the care that you're giving, and why do they present themselves to you that way. Not just because they may come from a certain area of the community or have a certain racial profile, but look at them as human beings first. And if we're all human beings, then are we treating human beings the way we would want to be treated ourselves? So this is the first priority, and it's very much grounded in the work that we've been doing. We've completed a readiness assessment Within the group, we're going to redo that again, hopefully in the near future for new folks. But the idea is for us internally to think about, are we prepared to do the work we say we want to do? And are we grounded in the principles of a shared value around equity and inclusion? And if we are, what does that mean in the context of HIP-Cuyahoga? So you've heard us use a couple of terms today, equity and equity lens, and I just wanted to make sure that people understood what it meant in the context of the work that we're trying to do within HIP-Cuyahoga. First, when you talk about equity, it is not the same thing as equality. Equity is providing all people with a fair opportunity to achieve their fullest potential. And it talks about justice in the way that people are treated. It's not about the people having the same opportunity. It's about meeting people where they are and ensuring that they have the opportunities based on what they bring to the table and confront you with. As somebody once said to me, it's the difference between giving everybody in the room a new pair of tennis shoes or giving everybody in the room a new pair of tennis shoes that actually fit them and is in their size. It's a big difference. One is equality, the other one is equity. And then we talk about using an equity lens. An equity lens, once again, is a perspective. And it really is looking at making public policy and institutional practice decisions that are governed by the principle of equity. So that means, are we looking at things in terms of it being fair and just in terms of opportunity? And are we willing to evaluate that piece in any kind of policy piece that we do? You know, when I do policy analysis, the things I was taught was the first thing you look for is effectiveness, the second thing you look for is efficiency, the third thing you look for is environmental conditions and whether it's politically feasible to do. And I don't mean big politics, I mean the small p politics. Is it politically expedient? But the last thing and the most important thing is it equitable? And if it's equitable, who is it equitable for? In all the policies I've seen over the last 25 years, very rarely have I seen a policy that ever was evaluated on the criteria of equity. That says a lot about who we are, because we go for the expedient piece. If we can get it done, if we can demonstrate return on investment, we're there. Well, there's got to be something more than return on investment if we're really an equitable society. So these are why the equity issue is an imperative. First of all, there needs to be a focus explicitly on race to achieve equity. And it's not a relic from a more bigoted and less enlightened age. I think many people want to say that, and I heard a lot of this back in 2008, that we're in a transracial society. I'm not so sure that a lot of people would say that today. And I'm not so sure that people really feel that today. I'm not sure they felt it then, but I'm not going to comment on what I think beyond that. I think we have to be honest with ourselves about what we see and how we do. Why do we live in segregated communities? Why do we go to faith-based institutions and they're segregated on Sundays and Saturdays? There's a reason for that, and it says a lot about who we are. We also know that race remains a fundamental fissure in America. It compounds and perpetuates disadvantage across neighborhoods and generations. Data is replete with this now. We don't have to speculate about it. It's not in any kind of debate anymore. The data is right there in front of us to see, and it has been evaluated as such. Living in neighborhoods of concentrated poverty has an enormous impact on opportunity, wealth, income, health, and lifespan. Just being reasonable, one could assume that if you live in conditions that are creating toxic stress every day, your life expectancy is going to be less than somebody who doesn't. And is there some way for us to reduce those conditions so that people don't have to confront that toxic stress every day? Is that a question we can address? Is it a question we should answer? The racial inequities confronted by people of color did not happen by accident. Go back to what Dr. Green said about every system being exquisitely designed to produce the result it gets. He also said that you could take the word exquisitely out and replace it with intentional, and that would give you an understanding of why our systems and structures work the way they do. The structure of our society was erected on a foundation of bigotry and racial discrimination. I don't think I have to say any more about that. I think it's kind of proven. And race was institutionalized into society before the founding of the nation. We had slavery in this country before we had the Constitution of the United States. That's what that statement means. Laws intended to dismantle legal discrimination have had to fight against custom, culture, and practice. And intentional counter efforts aimed at maintaining the status quo have been well-funded and aggressively implemented. The time is now. The nation's demographic shift from a white majority population to that of a country where people of color will outnumber whites have made achieving racial equity both a society and economic imperative. So the reason why we address this is not because this is something nice to do or something good to talk about. It's because what we understand is if we don't address this, then fundamentally we aren't addressing the things that undergird much of the work that we will have to do. It gets in the way. It acts as a barrier to us being successful. And what we also know is by the mid-century, inclusion will be the challenge everywhere in this nation. As the population shifts, more and more people are asking for and demanding to be a part of the democratic system in America, to be in a decision-making position, to have a say about not just where they live, but what goes on around them in their communities. That's not going to stop. It's only going to increase. And a focus on equity must drive collective impact in cities, aging suburbs, and rural communities. It is the only way that we can create solutions that reflect the scale of this nation's challenge.
So thanks, Greg, for that perspective transformation, depth of explanation. We wanted to spend a little bit time now actually unpacking the collective impact piece a little more. You've heard probably a lot about collective impact in the various sectors that you work in. There are a lot of collective impact initiatives. There are a lot of different ways collective impact is operationalized. You have heard us talk about this many times, and I mentioned the webinar we did 18 months ago, and we really took each of the conditions of collective impact and unpacked what we had done so far. But we're learning as we go. That is what collective impact is about. It's a structured form of collaboration that embraces continuous improvement, uses data, but it drives transformational social change. And that is not easy, and it's a long-term proposition that requires a long view and requires a systems perspective. And those are really hard things because those aren't necessarily the things we do in our day-to-day work. That's pretty transactional for most of us. You know, it's sort of like I have a certain number of widgets to produce at the end of the day. That's also known as clinical care for me, like how many office visits, how much billable did I have, right? And that's what I'm sort of judged on. That's not helping anyone, right? So I've got to get out of that mindset and think about what's actually driving transformational social change. But I'll be honest with you, there are days where that's really hard, right? Because we're so mired in the transactional stuff we do, which in many ways is very valuable work. So we want to talk a little bit more about how collective impact has changed us and changed the way we're thinking, and many of you have contributed to what we've put together here. This is a infographic that I really like. It's from FSG. I've showed it many times. Maybe you've seen it before. But I think it's really kind of highlights what we do. We do great individual impact. We all have a lot of great work. I can look out at this room. Some of you I don't know and look forward to meeting, but others of you know I know very well, and I know your work, and it's phenomenal. But we don't always necessarily have it coordinated. And so we're moving from individual impact to coordination. When we do coordinated work, we do even better work, right? But when it's collective and we have a shared agenda and we are sharing resources, that's a completely different ballgame. And so we're not there yet. We are not there yet in this community, but we're moving in that direction. And we want to talk today about all the ways that we can think to do that a little bit more incrementally each day. So just as a reminder, these are the 5 essential conditions of collective impact. They seem very straightforward on paper. They're pretty pragmatic, right? You have a shared agenda. That in and of itself is very challenging, but that's what the last 9 years has been about. Creating a vision and a mission and a guiding core value, creating outcomes that we all agree on, right? Maybe in sometimes those outcomes don't have as much specificity as we'd like in our own sector, but we can help figure out what that means as we move forward together. Shared measurement. So that seems pretty straightforward, right? We got a lot of data people in the room. I see many data people in the room. Qualitative data people, quantitative data people, and you all work for organizations which are replete with data, right? But the chance of using those data together for a shared agenda, which is the number 1, is really hard. It's not as easy as it sounds. So we're working really hard to try to figure out how we can share data, and we'll give you an example of what we're doing with regard to the assessment later. But there are a lot of ways that shared measurement is a challenge. But again, remember, collective impact is driven by data. So in order to make change, we have to actually measure to know we've made a change. Mutually reinforcing activities. This also sounds very straightforward. There are a lot of really collaborative, brilliant minds in this room, and you all want to help each other. But in the thick of the day, when you have a whole bunch of transactional stuff to do, reinforcing your neighbor or the organization down the street's priorities and helping each other is probably not the thing that's foremost in your mind when you're trying to get home for dinner and get your work done, right? So creating a culture and creating a way of working together that naturally is about reinforcing each other's work and working toward the collective shared agenda is a completely different paradigm for most of us, and it certainly was for me. So that's been something we've really tried to create a culture around, and that'll be at work until all of us are done with this work. That will be a big piece of what we're doing. Continuous communication is also another one. Many of you hate the amount of communication you get from us. Many of you wish you'd had more communication. We can never strike the right balance on the continuous communication, but the reality is that continuous communication is absolutely fundamental for HIP-Cuyahoga. And I can tell you that Greg and I, our level of communication just as co-chairs, I mean, like our spouses might wonder what the heck's going on because we are like constantly talking to each other, right? We're texting, we're emailing, we're talking on the phone multiple times a day sometimes. But that continuous communication is what has allowed us to be transparent in communicating all the challenges that we have with the rest of the steering committee, the rest of the consortium, right? That's just an example in the little microsystem that we have as the leadership, but that's also true for the consortium. And we really try to strike a balance and share when we have opportunities to put grants in together, opportunities to work together on something that's part of our shared agenda. And then the last thing is backbone support. So when we first set out in our infancy in HIP-Cuyahoga, we defined the backbone as the Cuyahoga County Board of Health and then every other organization that was anchored on a priority area. That is really hard. I think we had at one point like 8 backbone organizations, right? That just doesn't work. We learned as we went along, right? So the Cuyahoga County Board of Health has really been the continuous backbone, but with pieces of it brought in by our organizations, by the organizations of other people on the steering committee. And we're still trying to figure that infrastructure out. In a few slides, I'm going to be really honest with you about our challenges and the tensions we wrestle with as leadership team every day, and which you've known as consortium members from time to time. We're going to lay them out there because today's about figuring out how we move forward even better together as we leave this place this afternoon. So one of those challenges has been our infrastructure. And what do we do? And how do we support that infrastructure? Because it's really hard to support infrastructure. People want programmatic work. They want results. They want shorter-term results rather than this big systems change when you're asking a funder for something. And that's reasonable. So we've really struggled with that, but it's essential for collective impact. I also want to take a moment to talk about a few of these principles of practice. Some of you have seen these from us before, but as we were preparing for this today, I had some renewed energy around sharing these principles of practice again, particularly on the systems piece. So equity is a really key part of collective impact, and I'm going to talk about in the next 2 slides a little more. Community engagement, you know, our third key approach is also really essential. Cross-sector nature of this work is really important. We know that not every sector that we need to engage to make real long-term change is at the table. That's a continuous process of outreach and finding where are we dropping the ball, where do we have missing links, who else do we need to engage in this work. Using data, as I mentioned before, to learn, adapt, improve, respond to emerging opportunities. Those are things that are principles of practice and collective impact with regard to data. Cultivate leaders within, with unique systems leadership skills. So these are the 2 I really wanted to spend a moment on. So focusing on program and system strategies and cultivating systems leadership. Those 2 are really big because those are very different ways of operating. We're used to working in our own organization and having, you know, maybe a microsystem, but this is big picture system, right? We are all interdependent and we move one piece, it affects another. And so systems thinking is really important, especially as we think about the emerging opportunities that come about when we have new possibilities from working together we never dreamed possible. Like when you set out a strategic direction, you've got the people in the room making that strategic plan, right? When you start working across sectors and across organizations and thinking differently, suddenly the world opens to opportunities you never dreamed possible before. And particularly when you're thinking about applying an equity lens to that, you really think about long-term change might actually be possible. And that's really, I think, the hope that sustains both of us when the going gets tough here, and it does get tough often. So the other thing is I mentioned about building a culture, and we've tried to be very intentional, and I'll talk in a moment too about some things we did in 2018 with our steering committee, but building a culture of leaders in the consortium, really thinking about relational aspects of this work, building trust, building mutual respect. None of this work happens without those things. You know that people come into the room with a hat from their own organization, their own personal goals, and then the collective. And sometimes you don't know which hat people are wearing, and sometimes you think maybe they're layered, right? And if you trust your colleagues and you have mutual respect with one another to call each other out and say, where are we at with this? That's a very different way of operating than just making assumptions about why someone's willing to do something. So we've really tried to work within the steering committee to bring that culture and that trust together. But those kind of working relationships do not happen overnight. They take time. So that's another principle of practice, but one that we've really tried to operationalize. And then local context is really important. And so that's why we spent so much time at the beginning of this presentation reminding you about where we came from, starting with Place Matters, and walking through understanding the impact of structural racism in this community, because collective impact has to be locally operationalized, and local context is fundamental to that. So you didn't see a whole lot on the essential conditions. You didn't see anything about equity there, did you? On the principles of practice, you saw equity as an important part of this. But a lot of times in collective impact, equity isn't really explicit. And so early on in this work, after we decided on collective impact as our approach, we recognized the need to bring together perspective transformation and our approach around eliminating structural racism with collective impact. And how does that happen? And so we have worked with some consultants and learned from as many as folks doing collective impact as we can about how equity really is the heart and the soul of collective impact, and why is that? And you heard Greg allude to it in the last remarks that he just made. But we know from other experiences, and I think you're going to hear from our guests today, of other communities doing systems change work. We know this kind of approach can be empowering, it can be transformational, it can be long-lasting, but it's also a challenge, right? It's really hard. And as you get deeper into the work, I think I said this actually as we were coming up here earlier, I said, the deeper you get into the work, the harder it is, the more you realize you don't know what you're doing, and the more you rely on each other. And so having that shared emphasis on equity is so important, because at the end of the day, we come back and say, why are we doing this? We're doing this to achieve equity in our community, and we're using collective impact to do that, but they are not separate. They're the same. The other thing that we've seen before and other communities have shared with us who are further down the path of this work is that without purposefully bringing equity lens to bear on this, we miss opportunities to work together. People miss opportunities to actually make that big change. And I can tell you, I've done a lot of reflection on how equity has been infused into the organizations who've been really involved in HIP-Cuyahoga, and the change has been remarkable in many organizations in this community. And that over the last 5 years, the ability to talk openly about the impact of systems and structures on health outcomes and the differences in those, and the way that hiring practices work, and the way that people think about equity in their own organizations has changed. Not because necessarily they're part of HIP-Cuyahoga, right? But because we're all raising the narrative of why equity is so important and how working together we have to bring that equity narrative to work every single day, and we have to continually reinforce it with each other. So we really also wanted to talk to you for a moment about the role of systems thinking. We're going to talk a lot in a few minutes about systems change, but you've heard me talk today multiple times about emerging opportunities and ways of working together differently. And so I find it challenging personally, and even in my own organization, sometimes to think about the system because it feels really big and overwhelming. But without thinking about that system's perspective and the way that we can work differently together, those emerging opportunities are sort of missed. So I have really enjoyed personally thinking about how interdependent we are, and in healthcare, we don't do a really good job of thinking of our interdependence, right? Like, we're taught and we're trained in medicine in particular to think about how we can go it alone and how we can do what we need to do when we need to do it. And in fact, that's really not true. So for me, thinking about this has been a real paradigm shift, and thinking about the way that we impact systems and working together with public health and public policy groups and with workforce organizations and faith-based organizations and all the other sectors represented here has been really, really eye-opening, and I think has really impacted the way we think about healthcare, at least the way I do and a lot of the organizations I work with. So we will talk about this a little more, but we wanted to get your juices flowing around systems thinking and the impact and collective impact. All right, so I'm just gonna be transparent for the last few minutes here before we talk about where we're heading next, and talk to you about some of the tensions that we've experienced. We have talked about these, Greg and I have, other steering committee members have, from time to time. We did some steering committee retreats earlier this year, which Greg will talk to you about in a few minutes, and part of that was to wrestle with these tensions that are inherent in this kind of collective impact, equity-grounded work. So I'm gonna call out a few of them. Strategic direction versus emerging opportunities. I keep harping on that, but I can tell you how challenging it is to say we have a strategic direction and we're moving in that direction and we're seeking funding for that direction, and then something else comes on and it's like, wow, that's an amazing way of changing direction. Are we nimble enough to do that? And can we actually still contribute to the strategic direction we set out? So those are tensions, and they're not mutually exclusive, but they're a challenge when you're trying to think about funding something long term. Systems and policy change balance with programmatic work. I think this is one that Greg and I talk about almost on a daily basis because we have amazing programmatic work that partners are doing and that we are doing as part of our day-to-day jobs as well. That's a ton of time and energy, an amazing amount of impact in the community, but that can sometimes not easily couple with systems and policy change, right? If you're working on something that's very programmatic and maybe a little downstream, it's really valuable for that organization or that group or that neighborhood, but linking it back to the systems and policy change is kind of hard. So that is a problem for where you spend your time. It's also a problem for resource acquisition. So we're constantly wrestling with that in the leadership group for this consortium. Also, that leads to the challenge of evaluation. There are a lot of amazing evaluation minds in this room too. And I think any of you will attest to the fact that it's very challenging to balance evaluation of the programmatic work with evaluation of the overall consortium and where we're heading. Those are two different things. They're related, but they're two different things. And we've hired a number of consultants to help us with that and haven't really gotten that exact guidance we need, right? We're still figuring that out. But if we don't measure where we're going as a consortium, it's really hard to know how we can continue to empower the group to grow across sectors and do more transformational work. The other thing is the long-term status of this work or the long view of this work versus short-term wins. Short-term wins are great. They keep people energized. Long view is required to undo the unfortunate legacy of structural racism. So we've got to find a balance between those two things, and it's not easily found. Inclusion balanced with efficiency. We've talked about this as a steering committee. Greg and I went on a listening tour last fall, and we're doing it annually. We'll be doing it again here this month and next month with every single steering committee member to understand where they're at. Where do they see themselves in the work personally? Where does their organization see themselves in this work? Where do they see themselves in the shared collective agenda, right? We've got to know what all those things are. And including more and more people is a really slow process. So there's an efficiency piece here because people expect results. Stop talking about the problem and do something about it. But we also want to be inclusive, right? So there is that challenge, that stress and tension. Balancing organizational priorities and needs with those of the consortium. You heard me talk about the hats analogy a few minutes ago. But sometimes, from even me personally, I walk into a meeting, it's like, which hat am I wearing? Am I wearing the HIP-Cuyahoga co-chair hat? Am I wearing a school medicine hat? Am I wearing a clinical hat? Like, I don't know what hat I'm wearing today because they're in conflict many times, right? And so suspending that personal need or the organizational need for that of the collective is not an easy thing to do. And we all have employers. We all have accountability to those employers. So trying to create a business case for our employers and continued engagement in this work is really important, but also attention. And then finally, investment in authentic relationships, like I mentioned before, versus the pressure to deliver on short-term results. I mean, we certainly have experienced tension and the conflict that comes with that, right? Like, we want to show that we're making improvement, but we can't just waltz into a neighborhood where we have no relationships and begin doing some work, right? There's got to be a relationship, and that's got to be what the community is needing to do. And so there is a tension there as well. And these are not the only tensions we've experienced, but I want to be really clear about the fact that this is not for us to stand up here and toot our horn today and say, we've done great work for the last few years, let's continue on. We definitely want to leave with that positive attitude, right? But we also want to use the next hour or hour and a half to talk about how do we push through this? Because this turbulence is not unexpected. Anytime you're doing this work, you expect the turbulence, but how do we weather that together? And how do we weather it in a way that actually benefits our community in the end? Just me too? Yeah. Got excited to hand over to Greg again. All right, so I talked to you about the 2017 listening tour that we did, and we think that whoever the co-chairs are behind us, we're not going to be in these roles forever. And that's part of what we're doing is thinking about, transition planning for the whole steering committee, because none of us are going to be on this steering committee for 30 years, right? So the idea is who is in the steering committee now, and where do you see you personally and organizationally? And so we're doing that again. We did that sort of in a HIP-Cuyahoga 2.0 reset in the spring, where some people elected that their organization maybe wasn't able to commit resources anymore. They personally were moving in different directions. So our steering committee changed a bit, and it became smaller. And to be honest, that was one of the tensions we had, was a 30-plus group of steering committee members making decisions is a challenge, but we wanted to maintain that inclusion. So that was one of the things we did at the beginning. And then we also recognized a need to continue to build trust and continue to build capacity for the individuals on the steering committee and also for the roles that they fill in their organizations. And so we had a series of retreats. We did one with the Center for Creative Leadership and Common Health Action, who's a longtime Equity Ground and partner of ours, consultant of ours, came back and did another one. And then all of our steering committee members completed the phase 1 training of the Racial Equity Institute, REI. And so if you haven't done that, I would encourage you to continue to look. There are a few more dates left, but that has been pretty transformational in making sure that all of us understand actual history, not the history we were taught in school, right? That we understand our role in this, whether we're a person of color, whether we're a person who's white. We understand what we bring to the table, we understand the baggage, and if we don't understand that, we begin to understand a process for how to unpack that. That was really critical, I think, for all of us. And then strategic visioning is continued around a number of things. I mentioned earlier infrastructure, particularly around the backbone. How do you support backbone outside of a general revenue source when you're putting a lot of time in, but those people still have a lot of other responsibilities in their day jobs? How do we do succession planning? We're not here to tell you we're walking away tomorrow. However, our terms are coming to an end, and so we need to think very carefully about what does this look like as we move forward, because we're in a very different place than when we wrote the bylaws 8 years ago, right? A very different place. So we have drafted new operational guidelines, and that steering committee is working through those things. Funding, always interesting vision. Programmatic work. Where do we spend our policy time? And I hope this afternoon we hear a little bit more about that. And then we're doing a new assessment. We did one in 2018. You'll hear some details about that. But 2019 is the chance for us to do a wide community engagement around what priorities matter here. Eliminating structural racism is still going to be here. We're still going to do shared assessments every 3 years. But what other priorities have risen since we last did this 5 years ago? And so those 4 priorities you heard me talk about, 2 of them will probably stay as part of our consortium in some way. But there may be new ones that emerge as our community tells us what really is important to them and what needs addressed. And then the intentional shift from the focus on consortium partners to outward. We realized very early on in this work that we had a lot of work to do internally. Like I, as a co-chair, had a lot of work to do on myself around perspective transformation and understanding racism. I think a number of people have shared those kind of experiences on the steering committee and as part of the consortium. But we also now know that as we've spent a lot of time organizationally, internally, we also need to be looking at these other sectors and other partners. So thinking about in 2019 and 2020, what are the other outreach that we do? What is the other partnerships that we need to build? So here are some additional details on 2019.
Thank you. Okay, so what are we doing moving forward, which is, we think, critically important. We have some stakes in the ground around activities that are supportive of our work moving forward, but also kind of help to create a roadmap for us to create not just infrastructure, but us to continue to try to work around how we build a strong organizational capacity that is inclusive of both transformational and transactional approaches to making change. So in 2019, there will be a collaborative community health assessment. And this health assessment will not only include the local health departments, but it is this year, for the first time, we're bringing together local hospital systems. This has not happened before. It is partially mandated by law in the state of Ohio. But the other thing is that even when laws exist, people figure out a way to get around them. This is when people have come to the table and are actually sitting there and trying to figure out what their needs are and how those needs can be satisfied in the context of working with health departments and systems to incorporate better work and align that work better. So there will be primary data collection, and we are going through a process now of figuring out what are the right questions to ask, and we actually just got, I think yesterday, the list of questions back that we've been screening over the last 3 or 4 weeks so that we can finalize those. The other piece is that as a result of the data, the implication is that we will identify new shared priorities that we will work on. So that means a couple of things. First of all, some of the things that we are doing in HIP-Cuyahoga now may not transition forward, or they may, given what the perspective of this group is and our resource capacity. But the other thing we know is that there will definitely be new things that bubble up to the top. And we're going to have to confront how we address those new things in the context of not only their urgency, but their applicability to our ability to use perspective transformation and an equity lens to help inform the work in that way. Another thing I would like to just announce to the group, many of you heard that we were very successful in submitting a proposal to the CDC for their next round of REACH, and we were successful in being awarded one of 13 of the highest grants that were awarded, over $700,000 per year for 5 years. Those areas that we were, thank you. Many people in this room actually spent an inordinate amount of time working on that proposal, and once again, it is a primary and a fundamental example of what collective work together can do for our community. If we put our strengths together, use the assets that we have, we're able to be successful. And that was one of the things that was said by the evaluators about how we brought a group together based on the work we had done previously and incorporated people who had distinctive grants themselves on REACH and brought them to the table and included them in the process. There'll be 3 areas that we will be working on in terms of strategies. One is nutrition, and that will also include breastfeeding. We'll have physical activity, and we'll have community and clinical linkages. And the issue here, again, is for us. This is programmatic work, it's on the ground. But we want to do it based on our overarching equity lens perspective. And we want to make sure that in the context of this work, that equity is a leading part of it in our collective work so that we can learn from it and go back upstream with it. The other thing we need to work on, and this is something that, as Heidi just said, you know, the more we do, the more we understand that we don't know as much as we think we know. Well, certainly comprehensive evaluation is one of those areas where many of us have done evaluation, but to do evaluation of comprehensive community initiatives is very complex. And you have to understand systems change, you have to understand programmatic change, how do they link together, and then how do the values that are being supportive of your work, how are they measured as well? So some of this stuff is quantitative, some of this stuff is qualitative, but a lot of it is really how do you evaluate change in terms of a community moving through a process of becoming equitable? How do we do that? Who's done that? So you have to think about that and incorporate that into the work. Well, we'll be doing more work in 2019 to do that. We've had some people come in and help us. We've gone through the process last year of creating at least a framework that we think has some utility, though it's not exactly what many of us think is necessary for us to move forward, but we'll be working on that. And it's important to understand that, once again, we need to measure what's important and understand what's important so that we can be informed about that and have a good record of why we're doing what we're doing. And we're not just out here doing some things to be doing them for the purposes of feeling better. And the only way to do that is to really have a comprehensive evaluation framework that allows for us to understand not only the complexities of the work, but also where we get the most traction and why. The other thing that we will do is we will work with HPIO at the state level on health equity capacity building and initiatives. And once again, this whole idea of equity, which started actually by people thinking about how do we do systems change differently, is really a issue that is starting to get traction, not just here in our community, but across the country and internationally as well. So that there's a lot of research going on about equity now and its impact, but also foundations and major entities like universities are starting to think about their role in helping to demonstrate and understand the role of equity in community change. So we hope to continue through our relationship with HPIO to see how we work better with the state to inform them and also become informed about their equity work and our equity work so that we can align that work and have some sympathy to ensure that we're all working in the same direction. And then last but not least, many of you have heard of the ARCHES studies. If you haven't, it's a study that really looks at the issue of why people feel certain folks are deserving and other people are not to get certain things in society. And this is being conducted by researchers from Cleveland State University, University of Connecticut, and they're working through the Eliminating Structural Racism Subcommittee. We are actually looking forward to getting the results of their interviews. I think they said they collected and conducted more than 160 interviews so far, people, and they're now analyzing that data, and they will be willing and ready to present that data first to the subcommittee and then to the consortium. We think that that information will be rich for us to understand and also will help us further align ourselves with the prospective transformation piece so that we can advance into the future. So those are things that we're doing. We're also going to be, the one thing that's not on here is that we will actually be doing some work around succession planning. Heidi and I will be finishing our 4th year as co-chairs, and we've had a lot of fun. This has been very interesting. To be honest, this was nothing like what I thought it would be when I started. The time has been, even though it's flown by, it has really been intense, but it has also been a steep learning curve. And when I say steep, I mean a very steep learning curve, because I'm not a healthcare guy. I don't come with that background. So a lot of the nomenclature and a lot of the jargon that was spoken, I had to get a thesaurus out and try to figure out what the heck I was listening to. But one thing I am able to say is that I'm a better person and a better leader of an organization because of my work in HIP-Cuyahoga. And that's because, not just because of the equity perspective, but because I think that working together, we can solve many problems when we can't do that working by ourselves. So the ethic of collective impact has been very important to me. So 2 things I think are very important. Equity and collective impact have become kind of hallmarks for us to work from. And I would just like to say, as we go through 2019 as a transition year for leadership, that we are not going away, but we certainly hope to take a less intense, for lack of a better word, role. But we'll still be here and still be available to work in our subcommittees and also with the group at large. So, now comes a treat.
So many of you have heard or watched our video, but we thought, having gone through this little trip along memory